Have you heard about the new COVID variant that's been making headlines? It's called the JN.1 variant. This new player emerged on the scene in an unexpected location, brought to light through the power of routine genomic surveillance. These regular checks, like detectives sifting through genetic clues, are our first line of defense in identifying and understanding new threats. The discovery of JN.1 wasn't an accident, but rather the result of meticulous science and unwavering vigilance. This variant, with its unique genetic makeup, has raised eyebrows among health officials worldwide and sparked a renewed focus on our ongoing battle against COVID-19. But what exactly is different about JN.1? Why does it matter, and what does it mean for us? The answers to these questions lie in the very heart of the virus, in its genetic code. The discovery of the JN.1 variant underscores the critical role of genomic monitoring in our battle against COVID-19. So, what makes the JN.1 variant different from the others? Well, preliminary studies have shown that the JN.1 variant carries some distinctive genetic mutations. These differences have raised eyebrows in the scientific community. Why, you ask? Because these genetic quirks might potentially affect the variant's transmissibility, its severity, and even the effectiveness of our current vaccines. Now let's talk about its global spread. The JN.1 variant has not stayed put in one place. Oh no, it has packed its bags and traveled far and wide. It's been reported in multiple countries across the globe, and this has prompted a swift and coordinated response from international health officials. These professionals are collaborating to track and contain the spread of the variant, with a laser focus on regions where cases have been identified. The JN.1 variant has now been reported in multiple countries, triggering a coordinated international response. How are health organizations and governments responding to the JN.1 variant? In light of the emergence of the JN.1 variant, global health organizations and governments are springing into action, implementing a series of strategies to curb the spread of this new variant. Indeed, the response has been swift and comprehensive, showcasing the lessons learned from previous waves of the pandemic. At the heart of these efforts is increased testing. By identifying cases early, health officials can isolate infected individuals and initiate contact tracing, thereby breaking the chain of transmission. This increased vigilance allows us to keep a close watch on the variant's spread and make informed decisions on public health measures. Alongside this, enhanced genomic surveillance is being ramped up. By sequencing the virus from positive test samples, scientists can track the variant's evolution, identify new mutations, and monitor its spread across regions. This vital information informs our understanding of the virus and helps guide our response strategies. Public health guidelines are also being updated to reflect the latest understanding of the JN.1 variant. These may include recommendations on mask wearing, social distancing, and other preventive measures. It's a dynamic process, adapting to the ever-changing landscape of the pandemic. Perhaps most importantly, health authorities are emphasizing the crucial role of vaccination and booster shots. Vaccines remain our strongest defense against COVID-19 and its variants. They help to reduce the severity of the disease, lower hospitalization rates, and ultimately, save lives. Booster shots, in particular, are seen as a key strategy to enhance immunity, especially against emerging variants like JN.1. While the JN.1 variant presents new challenges, we're not defenseless. Vaccinations, booster shots, and public health measures are our best weapons. What do the experts say about the JN.1 variant, and how can we stay informed and prepared? Leading virologists and epidemiologists have shared insights on the potential impact of JN.1, emphasizing the critical need for continued research, monitoring, and data-driven responses. This variant, with its unique genetic mutations, is a reminder of the virus's ability to evolve and the importance of our readiness to adapt our strategies accordingly. In these complex times, it's essential that we all stay informed by relying on reliable sources of information. Health officials worldwide are urging the public to adhere to recommended guidelines and remain vigilant. Now, more than ever, it's crucial to practice good hygiene, wear masks, maintain social distancing, and get vaccinated if you haven't already. Remember, vaccination and booster shots play a key role in enhancing immunity against emerging variants like JN.1. As we navigate this evolving landscape of COVID-19 and its variants, we must remember that staying informed and prepared is as important as ever. Together, we can contribute to the global effort in combating this pandemic. As we face the challenges posed by the JN.1 variant, what's our way forward? The path lies in unity and vigilance. It's about scientists, health officials, and indeed every one of us working together, staying informed, and adopting responsible behaviors. Ongoing research and vigilant monitoring are key to understanding this variant's impact and devising effective strategies to mitigate its spread. It's a global fight, and every contribution counts. Together, we stand united in our commitment to overcoming the challenges of the COVID-19 pandemic. Stay safe, stay informed, and remember, every action counts.